Representative Delozier.
Thank you very much. Mr. Secretary, I wanted to go to, it's kind of on the issue of consolidation as well, but I wanted to go to so much of the agencies that are talking about being consolidated have a direct pass-through in many cases to our counties. And so I wanted to ask a question on kind of their behalf as to saying, what is it that you're looking at with the consolidation, should it go through as it is planned? What are you doing to educate the counties on how their services or how their communication with those agencies may or may not change, and are you making sure that the services will be uninterrupted within the merger?
So first I would note that there are several counties that are already consolidated along the lines. We have Allegheny County, for example. They've realized some significant benefits through that consolidation, and the way they're set up would look at a lot of the way the state is set up, so that might make some of the communication easier with the counties. What we've done in terms of speaking with them is we've reached out to CCAP, the county association. We've had several discussions with them already. Commissioner Hartwick, who is the head of the Human Services Committee, I've had several meetings with him. We've had meetings with the Human Services Committee. I think both Secretary Osborne and I are slated to go out and speak at the next CCAP meeting here in Harrisburg and talk to them about how we engage. Because your point is a critical one, which is of the services, there are some services we provide directly at the state level, but there are a lot of services that we rely on the counties to do that. So part of it's giving them money, part of it's coordinating policy. Having that conversation with those county commissioners, with their human services directors is a vital part of this. Those conversations have already started. They'll continue through July 1st, and should the consolidation occur, they'll continue after July 1st.
Okay, and I would just wanted to stress the fact as to that they are the receiving end and have to deal with whatever you guys decide at the state level, and that communication is imperative to make sure that they can do their jobs.
They're not a shy bunch. They have made the same point.
No, that is very true, as I've heard. On the flip side, also that goes along with that, with my question that I had asked before, is that consolidation of the fact that so many of the possibilities of consolidating, not having 700 people talking to the counties, maybe bringing it, reducing the number. Again, as I mentioned, cross-training and the ability to have less bureaucracy within government, that's always a good thing. So just throw that out there. And then also, I wanted to ask, is it something small within the budget, but it's something that I know at my neck of the woods with the child care is the Keystone Stars program. Sure. The Keystone Stars quality rating and improvement system that had gone into effect. Can you kind of give us an update as to, because more of the child cares would be eligible, my understanding is, in order to have a Stars rating. Can you tell me about those that would be more eligible, as well as where that program stands? So
the Keystone Stars program is how we are measures of the quality of services provided, and there's certain things that each provider has to do to earn those stars. Right. The 3 and 4 star providers are the ones that are the highest quality ones we have. Through our system, we reimburse them as a higher rate. We want to pay for quality. If one of the tenets we have is that we want providers to achieve those quality services, we should put our money where our mouth is and reimburse them at that higher rate. We have done that. As part of the process going forward, we're doing something called a STARS redesign. And to me, that is, when you look at the Keystone Stars program, it grew up in pieces. It grew up over a period of time, and it's starting to show its age a little bit. The process right now is working with providers, working with stakeholders to look at that system, streamline it in some cases, and help folks make that leap from 2 to 3, which is where the big increase.
And can I just get a question out real quick before that thing turns red?
Okay.
With that whole process, it's level funded this go around, and you mentioned about giving more incentives and paying more. How is it that you can pay more for this, for those that are for that higher incentive with a level funding?
So I think that there's some internal reallocation within the funding we have, but I think there also there's some initiatives we have to help reduce the waiting list and improve home visiting. So it's not, child care is not completely level funded, but there is some reallocation within the dollars that we have now.
Okay, I didn't know how that math added up. Thank you very much.